The thing about sciatic pain is that it's very treatable through movement and exercise. We may need to implement some activity modification strategies, but for the most part, we can take care of your symptoms through a series of stretches and then follow that up with some exercises to make your pain gone for good. Let me show you how. Hey everyone, my name is Dr. Jacob. I'm a doctor of physical therapy and I've been in orthopedic practice for the last 10 years. Be sure to follow my socials for all the latest tips and tricks on how to stay out of the doctor's office, orthopedically speaking, of course. One of the most effective ways to reduce sciatic pain symptoms is to stretch the posterior fascia and soft tissue structures of the glutes and back of the thigh. There are a few ways to do this. Let me show you a few options. Seated on a chair, cross the affected leg over the other in a figure 4 position. Pull the knee up and cross to the opposite shoulder. Hold anywhere from 5 to 30 seconds. A variation of this would be to lower the knee so that the affected leg is parallel to the ground. Then lean forward from the chest. Also hold for about 5 to 30 seconds. Next variation, lay on your back, bend both knees, cross the affected leg over the other into figure 4 position. Gently pull the knee across midline and feel a good stretch in the glutes and back of the leg. While in the start position, you can also grab behind the unaffected leg and pull both legs towards your chest to get a nice deep glute stretch here as well. And finally, one of my favorites because it's easier and you can remain in the position for a bit longer, lay on your back with your feet up on a wall, cross the affected leg into figure 4 position, then slowly slide your unaffected foot down the wall, hold for roughly 30 seconds as well. This next series of exercises targets the lumbar spine and assumes that the spine pain is stemming from a herniated disc in the low back. Getting into an extension position is one of the most effective ways in reversing a disc herniation, although please note that there are some instances where lumbar flexion or bending forward is more tolerable and also effective at improving a disc herniation, which I can go over in another video. Back to extension, you can start by doing some cat-camel exercises as shown here. Focus on your pelvis and rock forward and back. We're typically doing about 20 of these. The progression of this would be to do some lumbar extension exercises up against a wall or utilizing a mid to low chair. Either way, your arms stay straight while you slowly allow your pelvis to lower or lean forward. Let's hold the end position for about 5 to 10 seconds and repeat about 10 to 20 times. You can also do this exercise on your stomach, laying on your bed or on the floor. Start by propping yourself up on pillows and remaining in this position for a few minutes or longer if it's feeling good. Slowly progress yourself into a press up exercise, pushing your body away from the floor, keeping your lower body down, arching your back. Make sure all of the work is coming from your arms and you are not using your back muscles to hold yourself up. Hold the top position for about 3 to 5 seconds and slowly lower yourself back to the ground. Let's do about 8 to 10 reps, take a break, then 8 to 10 more. And finally, let's mobilize the sciatic nerve itself. The sciatic nerve can get caught anywhere along its pathway causing pain, so flossing the nerve back and forth can be incredibly effective in relieving sciatic pain. This is a beginner variation. One rule of thumb, toes up, toes down, nose down. Your toes always point in the same direction as your nose. Got it? Okay. Laying on your back, grab behind your knee, bend the knee, point the toes down while simultaneously bringing your chin to your chest. Then extend the knee straight, point the toes up towards the ceiling, and lay your head back to the ground. Move slowly back and forth with this one. You can also do this in the seated position, hands behind your knee again, bend your knee, point your toes down, bow your head forward, chin to chest. Then extend the knee straight, flex the foot so that the toes are pointed up, extend your head back so that your nose is also pointed up, about 20 times back and forth, slow and controlled. I hope this helps for now. Leave a comment if you have any further questions or requests for future content, and stay mobile, everyone.